The COVID pandemic impacted me negatively because it was much more difficult to see my friends in person during quarantine, and it was also harder to enjoy the outdoors as much as I used to before. And some things that I like to do to take care of myself mentally are getting boba with my friends and running and working out at the gym.
Beams, y'all. I'm Andrew Defy, aka the Gorilla Poet Laureate, aka the Hoodie God, aka Spittin' Quarantino, aka I wear my sunglasses at night because my eyes are as sensitive as my heart is, y'all. And we are back with another episode of the internet's favorite community health live stream show where we break down and dive deep into the latest medical news and interview some of the healthcare industry's thought leaders on all kinds of topics. Tonight, we have the founder of the first LGBTQ cancer network, Liz Margolies. And since she's a specialist in the field, we are going to focus on cancer for this whole episode. We're going to cover the importance of our LGBTQ family getting regular cancer screenings, the science of tanning, sunburns, and skin cancer, and how skin cancer is not just a white disease. Go put some sunscreen on and get ready because the show starts now. So the Delta variant is picking up in California as it has around the rest of the country. Before I play this clip, since what we do not do here on this show is just push fear tactics, I do want to mention that it's important for news outlets to report case numbers as well as percentages, because if COVID cases themselves are down and the variant cases are rising, then the percentage numbers are going to seem bigger and scarier than they actually are. So y'all make sure you go look up the numbers locally. We're not trying to scare you here. This is not a propaganda show. A quick Google search will help you. Nevertheless, the variant is something to take very seriously, and a lot of California's major cities are gearing up to reinstate mask mandates. LA already has. Where's next? Shout out to our friends at NBC Bay Area for this.
Hours ago, LA County leaders making a major change, now requiring masks indoors despite vaccination status. You got to do it even if you're fully vaccinated. Is the Bay Area next? Here's NBC Bay Area's Melissa Colorado. She spoke to an expert who thinks the Bay Area could soon follow LA's lead.
If you're vaccinated, don't throw away that mask just yet. The highly contagious Delta variant is causing cases to go up in COVID hotspots across the country, including LA County, where COVID cases are growing at a rate of more than 1,000 a day.
Masking indoors must again become a normal practice by all, regardless of vaccination status, so that we can stop the trends and level of transmission we're currently seeing.
UCSF's Dr. Peter Chin Hong stresses the Bay Area's vaccination rate is much higher than LA's. Take San Francisco, for example, where 76% of eligible people are fully vaccinated. Across the Bay in Alameda County, it's at 70%.
Hopefully that force field will keep the numbers relatively low, even though the percentage increase is going to look very dramatic. And most importantly, keep hospitalizations and deaths low.
The highly transmissible Delta variant is spreading quickly in places like Yolo and Sacramento counties. Health officials there are now strongly recommending everyone wear a mask in public indoor settings. How soon could a Bay Area county follow suit?
Even though it's going to be a psychological bummer, I know, to many people. So in short, I think it will probably come here.
Dr. Chin Hong thinks indoor dining will still be allowed, but he's predicting some counties might reissue mask advisories in the near future.
You might see it in Contra Costa or, Solano County based on these numbers that they're seeing.
We reached out to a handful of Bay Area health departments and are waiting back for comment. In Oakland, Melissa Colorado, NBC Bay Area News.
As our guest tonight will tell you, cancer affects the LGBTQ community very heavily, and some of this is just due to a lack of testing. The Mayo Clinic just put out this video last week about the importance of cancer screenings for our LGBTQ family.
Going to the doctor can be scary for anyone, but especially for some.
One of the things we see is that so many members of our LGBTQIA community are just scared to come to the doctor in general. They're worried about being judged for life choices or sexual preferences, and they're not comfortable talking about that.
And that means missing important healthcare screenings.
They're missing their breast cancer screenings, they're missing their colon cancer screenings, they're missing their cervical cancer screenings.
Dr. Erb says she's concerned that some patients who are transgender may forego cancer screenings.
For our transgender patients, that can be a much more sensitive topic because the organs that you have, you may no longer identify with. And so if you don't identify with those organs, you might not want to come in and have them examined.
Dr. Erb says however you identify, it's crucial you get health care.
We want you to be your authentic self, and so that you can come in and we can treat you.
The bottom line, says Dr. Erbs,
If you come in for your preventative screenings, it very well could save your life.
for the Mayo Clinic.
This leads into our guest tonight perfectly. She is a clinical psychotherapist who is specifically trained in health disparities, trauma, loss, and sexuality. She is also an active volunteer, political activist, and the founder of the first ever national LGBT cancer network. Through the network, she has created a safer space to educate, advocate, and have open conversations about the risk of cancer in the LGBTQ community. The National LGBT Cancer Network has also helped train healthcare workers to be more compassionate and advocate for more information spread about the issue. Before establishing the network, Liz Margolies was a coordinator for the Lesbian Cancer Initiative in New York City, which was the first to address transgender men and women, as well as bisexual and lesbian individuals living and dealing with cancer. Liz was chosen in 2014 as one of Out 100's most influential people for her amazing work. Y'all, welcome Liz Margolies to the show. Tell us, how are you doing, first and foremost?
I'm good. I just moved 2 days ago. I'm in New York City. I went from 16th Street to 11th Street, but still, it's a big deal.
I was going to say it's a bigger move than it sounds to those of you watching from California. That's still a big move.
Every move in New York City is a big move. So don't ask me to find anything, but I'm fully here with you.
So we wanted to talk to you because you are the founder of the National LGBT Cancer Network, which was the first ever national program to address the needs of LGBTQ plus individuals who have or are at risk of cancer. What motivated you to start this organization?
Actually, something terrible motivated me, but that's the truth, and I assume that's what you want. I had 4 friends, all lesbians, and I'm a lesbian too, by the way, die of ovarian cancer in their 40s and 50s. And like, what are the odds of that? Either I have like really bad luck in choosing friends, or there's something about increased risks in this population. And I began to look into it, and I found that, yes, we have increased risks for cancer, lower screening rates, and multiple additional challenges in survivorship, meaning cancer is a big drag for everybody and terribly frightening, but it's extra hard for this community. And I saw that these health disparities, as they're called, meaning a disproportionate burden of disease, was not limited to lesbians and ovarian cancer, but was true in slightly different ways for all of the subpopulations of the LGBTQ plus community.
So why are LGBTQ plus individuals at a heightened risk of developing cancer?
Great question, because most people say cancer doesn't discriminate. So cancer is just rogue cells, right, that proliferate and don't die and do what they're supposed to do. It's not because our bodies are different from our cisgender or heterosexual siblings or friends, but the life that we live as sexual and gender minorities puts us at increased risk for behaviors that increase our cancer risks. For example, my community uses tobacco products, either vaping or cigarettes, at 50% higher rates than the general population. And that increases the risk for multiple kinds of cancers. What we say for lesbians is that they have the densest cluster of breast cancer risks. Smoking, as I said, using alcohol. The whole LGBT community drinks much more than the general population and uses drugs at higher rates than the general population. Lesbians are less likely to have a biological child before age 30, which would have some protection to it, and are more likely to eat a high-fat diet or have a high body mass index. Now, each of these increases your risk for breast cancer, and many lesbians have all of these increased risks. Then we couple that with wariness of the healthcare system because it's not treated us very well in the past, lower health insurance rates. And so we're not necessarily going for our cancer screenings like mammograms in the breast cancer example as often as we should. And so we can end up not only with more cancers, but a cancer that's been diagnosed at a later stage.
So like the AIDS epidemic helped draw more attention to the health disparities amongst our gay brothers. However, health disparities affecting lesbian women are often left out of the conversation. Why do you think this is?
Well, I think there's a big difference. I'm going to get to answer your question. HIV is a sexually transmitted disease. Cancer is not. And so there was a lot of blame and stigma that went along with HIV. And gay men have higher risks of anal cancer, for example, by engaging in anal sex, which is often caused by HPV, the same virus that causes cervical cancer in women. But I think that there was a lot of money ultimately and attention given to the AIDS crisis as it deserved. And it was not initially so. I mean, Reagan was terrible about the AIDS crisis. But we don't know that bisexual women have the worst health disparities, and bisexual men as well. The bisexual people have far worse health disparities, all of them, than LG people, lesbian and gay people. Transgender people also have terrible health disparities. But you have to care about this population to fund the research into it, and you have to collect data about it so that we know. So I can tell you for sure that lesbians have a much higher risk of breast cancer because of the factors that I told you. But I can only cite very small studies to tell you that we have higher rates of breast cancer. Because when anybody goes to a cancer center, their tumors are sent to a tumor registry. One of them is called SEER, that's an acronym. And so we know a lot about who has these tumors. We know about race, for example, because they collect racial data. We know, back to breast cancer, that white women are far more likely to be diagnosed with breast cancer, but Black women are far more likely to die from it. That's a health disparity. And we could also look at race and see what treatment protocols people got. And Black women are less likely to get the standard treatment protocol for breast cancer. We could see at what stage it was diagnosed, et cetera. But nobody is collecting data about gender identity or sexual orientation. So we are in all that SEER data, but we cannot pull it out and say how much cancer we have. There are some states, though, that ask about sexual identity and sexual orientation and gender identity in their state health surveys. Every state has a health survey. California, your state, does collect that information. So when they ask a question like, have you ever been diagnosed with cancer? They know that LGBT people say yes at 50% higher rates than the general population. That's not enough to make a lot of statements about. California said yes, because who knows? California, it's on the coast. It has a lot of queer people. That doesn't tell us about Arizona or Minnesota. So we really are pushing for people to ask about sexual orientation and gender identity, and for the tumor registries to collect this information, because we need that for the research. And when you don't have that data, it's harder to then get funding. How? I don't know that that's true. Show me that it's true. I can't really show you that it's true except indirectly.
Thank you for that. I was really hoping that you were going to touch on the lack of data collection and how that contributes to the health disparities.
I'd like to say more about that if I can first.
Yeah, absolutely.
Most people think that it's intrusive to ask people about their sexual orientation or gender identity. And there was a really interesting study in an emergency department, and they asked people who were LGBT and T, if asked in the emergency room, if what your sexual orientation and gender identity were, would you tell them? And 90% said yes. Why? I want you to know who I am. I want you to know that that person I brought is not my next door neighbor. She's my partner. I want you to know what my vulnerabilities are, what language you should use with me, etc. But when they asked the emergency department providers, would you ask? 70% said no, because they thought it would be intrusive. So we're at a please ask, we want to tell you. And I don't care if you ask awkwardly, you'll get better at it if you practice. So providers are always like, but what if I say, what if someone says, what, do you think I look like a lesbian? If you ask everybody what their sexual orientation and gender identity is, and they say, what, do you think I look like a lesbian? Then you can honestly say, I don't know what a lesbian looks like. I ask everybody these questions. Usually we suggest that you preface it with, I'm going to ask you some personal questions that I ask absolutely everybody. And again, 90% want the chance to say, yes, I want you to know who I am. And if we could bring our whole selves, our authentic selves into treatment, I think we'd be far more likely to go when we first experience symptoms. We'd be far more likely to get screenings for cancer, etc.
I love it. I love it. And I love bringing our whole selves everywhere. Like,
exactly.
Absolutely.
Okay, could you imagine going to the doctor and the doctor doesn't understand why you want to wear your sunglasses indoors?
Right.
And the doctor's going to interpret it as rudeness or distance or snobbery or arrogance or something like that. To be like, no, you need to understand me. I'm like this because I have highly sensitive eyes to light.
Absolutely. Absolutely. And I mean, you often talk about the need for increased LGBTQ plus cultural competency within medicine. Can you define what LGBT cultural competency looks like for us?
Sure. But first, can I expand it beyond medicine?
Yeah,
because so much happens. Let's imagine we have a perfectly culturally competent provider. Let's have this doctor be he. But before the patient ever gets to their culturally competent doctor, they have interacted with the security as they walk into the hospital, if it's a hospital. They have clerical staff. There's the triage nurse. There are many people. And you have to, or we have to, train all of them to understand how to treat us, because to treat me, you have to know who I am. And it's not just my finger, my heart rate, my pain level. You have to know about my life, because it's our lives that determine everything that happens in the healthcare setting. So back to your question, what is cultural competence? It's a variety of things. It's some knowledge about health disparities, like knowing about the smoking rates, et cetera. Like if you see a transgender woman and you know that trans women have high rates of HIV and often don't even know it, you would then ask her when her last HIV test was and encourage her to be tested. Like, you have to know who your patient is. So some of it is knowledge, knowing that we smoke and drink, et cetera, and about vulnerability for people who have anal sex, which is not just gay men, by the way, but anyone who has anal sex should be tested for anal cancer, like a cervical cancer swab. It's a very simple test. So some of it is knowledge. Some of it is like clinical stuff, like knowing how to do an anal swab. Some of it is a matter of attitude. So we want to change like hearts, minds, attitudes, and clinical behavior. So I want people to care about what it means to be sitting here as a queer person. What we all bring our entire medical history into any encounter we have with the healthcare system. And if you knew about that let's go to a different statistic, that 20% of trans people are turned away by a healthcare provider solely because they're trans, before they even said anything about the cough that they came in for, you would understand why the trans person is wary and seems a little standoffish. We know that 50% of trans people have to teach their doctors how to treat them. And nobody else would expect that that would be true. In my other life, I am a psychotherapist and I have a private practice. And I had a trans woman in my practice who had terrible abdominal pain. And she went to the emergency room and the doctor said a perfectly reasonable question. Do you think you might be pregnant? Because it could have been an ectopic pregnancy. And she said, no, I'm trans. I don't get my period. And he said, you're going to have to explain that to me. And she said, I'm in terrific pain. Could we not have me teach you right now? Nobody in an emergency department should have to train their doctor how to treat them.
Absolutely.
So some of it is knowledge, some of it is caring, and some of it is like knowing things to do, like some clinical things, understanding how testosterone affects other organs, and trans guys who take T, as it's called, testosterone, can have heightened cholesterol. So you just want to be sensitive to these things. And instead of saying, is your husband here with you? You want to say, who is your support system? Because our support systems don't look like the mainstream population. In terms of cancer, most people's support system in order is their spouse and then their parents. And many LGBTQ plus people have been rejected by their families solely for being queer. And while we'd like to think that that would change with a cancer diagnosis, I remember someone told me that she called her estranged mother up the night before her cancer surgery, and her mother said, I wish you were dead and I hope you die on the table. So you can't expect that these things will be overcome even with something as challenging as a cancer diagnosis. So we look to our first source of in our community, and many people saw this in the AIDS epidemic, that the first source of support were friends. The second was ex-partners. Third is siblings. Fourth are parents. So you need to know who's going to take you home after the surgery, or after I do it, who am I going to tell of the results of whether when we opened you up, we found cancer or not. And if you want someone to heal and you want them to trust you, you have to say, I care about who you are. And I care about who your people are, not who most people have as their people.
Right, right. Well, in addition to increased cultural competency, what other changes or policy initiatives do we need to implement to decrease these health disparities in the LGBTQ plus community?
Well, as I was saying before, it's not just the provider, it's the whole healthcare system. And then I'll work, okay, so we have the individual provider that we can train, and then we need to change the system. Are there bathrooms where it's safe for trans people to pee? Because many health disparities in trans people are caused by not feeling safe going to a public bathroom. See how you're drinking water? If you're trans and you're out in public, you don't let yourself drink water because you might have to use a bathroom. And people are harassed and beaten up in bathrooms.
Mm.
And you saw there were bathroom bills. I think it was North Carolina, South Carolina, where they want you to go to the bathroom based on your sex on your birth certificate. But if that's female and you now have a beard and present as male, you cannot go into the women's room. It's not safe for you there. Neither is it the place that that trans guy would feel comfortable.
Right.
So there are policy things that would help make it safer. Single stall bathrooms, all gender bathrooms would help people. It would improve health by just letting people be able to drink and not get dehydrated and get bladder and kidney infections from the dehydration. And we need statewide bills that protect us. Because we know, for example, in states that do not have protections for LGBTQ plus people, we are 5 times more likely to have 2 or more mental disorders. It causes anxiety and depression and a sense of unsafety. You, if you're not part of my community, and I don't make an assumption that you are or aren't, you could travel state to state and you don't need to think about it. LGBTQ plus people think about it every time they cross a state border. Am I safe here? Am I not safe here? And we are looking at some national bills to guarantee safety that prohibit discrimination based on gender identity and sexual orientation. So it goes from the individual all the way up to the federal level.
Oh, thank you so much. This has been such a great interview, and thank you for going so deep with us.
Thanks.
I have one more question for you, and it is the question that I ask everyone that comes on this show because I am an expert joy hunter. Where are you finding your joy today?
My joy is walking. And it sounds small, and you probably don't do much of it in California, but I live to walk. And I found a Latin phrase, solvitur ambulando, and it means it is solved by walking. And it has been proven over and over and over again to me that if I am unreasonably upset or excessively upset for a very reasonable cause, walking is the answer. It takes more than a mile. It takes more than 2. And we now understand how that works even with the brain. If you've ever heard of EMDR, which is a technique, a psychological technique for overcoming trauma, it's about bilateral stimulation. So left, right, left, right, left, right. It's magical for me, and I take that seriously. It makes me happy. Today, I walked 5 miles fast without stopping.
I love it. I love it. Just the little things, right? Like these little things that we can find our gratitude for. That's the key. That's the key to the joy hunt.
And New York City is fascinating. Around every corner, there's another dog like you've never seen, an outfit that's memorable, a movie being shot, a spectacular building. It's just a place you can just set off in any direction and walk for 5 miles and come home with a story.
Absolutely. Absolutely. It's been too long since I've been out there, but I'm going out in September and I could not be more excited.
Okay.
So thank you again for just taking the time with us. I know you just moved and you're in the middle of all of that, and you still took the time to sit down with us, and we really appreciate it. And just digging that deep with us. I know I walked away with a lot of new brain wrinkles, and I think our audience did too. So we'll have to catch up on the other side of this pandemic, and just thank you again.
Thanks for caring about my community and our health and your willingness to listen. It means a lot to me too. This is how we change hearts and minds and ultimately behavior.
One of the most common kinds of cancer is skin cancer, and it affects everyone. It's a common belief that those with more melanin, aka our Black family, are less susceptible and even immune to skin cancer because of their pigment. But is there any truth to that belief? To find out, we turn to this video from Mayo Clinic, Southern Africa.
My scars. I call him Ugly Betty and his sister. This journey started, I saw a mole on my knee. It looked so cute. It was the cutest thing, and I was like, yes. So I was always showing it off, and it started to grow and it changed form, and I was like, well, that doesn't look the same anymore. But I ignored it. And then it started being more painful, and I couldn't understand why, because to me it's just a little more. My friends, black people, we call it kuku. So we're like, kuku, and little did I know that, there was a whole thing behind it. I knew then that I had to do something about it, but I still took another year to eventually go in and go to the doctors and get it checked out. When I went into the dermatologist, I had a biopsy done, and they gave me the diagnosis, and I didn't know what to do with my life at that point. I was trying to figure out what skin cancer was, what it meant to me as a black person as well, to have this so-called white people's disease. Because we have that belief that, cancer is a white old person's disease. And now here I am, a young black girl. What's happening? How am I, finding myself in this situation? So after 6 months, then I had to go in and get my surgery. With skin cancer, more so malignant melanoma, it's such a dangerous form of skin cancer, and I was so fortunate that with my treatment, I didn't have to go through chemo. I just had the surgical option, and I didn't have to go through radiation as well. So I felt like I scored there, But the after effects of it are still with me to this day, because I have difficulty when I'm driving sometimes. Who would have thought that, such a disease would, end up giving me such side effects at the end of the day? So I'm 2 years cancer-free now, which is fantastic. And I'm loving life because I have a new lease on life. I have a responsibility to society as a whole, and I think definitely to people of color. Cancer does not discriminate. It doesn't care who you are, where you're from, what you've been doing with your life. It's just like, hey, it doesn't even knock. It just comes in, and you just, how do I deal with this? What I've come to learn is that, silence is cancer's best friend, because if we're quiet, nobody knows anything. Nobody learns if you're quiet. So know your body. Definitely know your body. Be aware of little changes and how they develop over time. And if it can help just one person, I think I've done my job.
So now we know a little bit more about skin cancer. It's actually the most common form of cancer in the US and worldwide. 1 in 5 Americans will be diagnosed with skin cancer before 70, and at least 2 Americans an hour die from skin cancer. But what is skin cancer and how is it caused? For a thorough breakdown of the science, we tune into our friends at Super Scienced.
The sun is awesome. It lights up our world, feeds the plants, helps us make vitamin D, can make us beautiful with a nice bronze tan, and of course it does a ton of other amazing things, but it's not perfect. It can also cause sunburns, aging, saggy skin, and many types of skin cancers. So in today's video, we're going to talk about the different types of sunlight, how they cause cancer, and how and what to protect yourself with. The sun releases many wavelengths or energies of light. The light that reaches the ground is about 53% infrared, 43% visible, and 4% higher energy ultraviolet light. Ultraviolet light has the ability to penetrate your skin and cause DNA damage. The types of ultraviolet light can be broken up into 3 groups based on their wavelength. The Earth's atmosphere absorbs almost all of ultraviolet C, or UVC, so it does not cause much damage to people. Much of the UVB light is blocked by Earth's atmosphere, but some does end up reaching the ground. UVB can also be blocked by sunscreen and glass, surprisingly. And the UVA is not blocked at all, so it can be damaging all year round at any time during the day. Your skin is an amazing organ and does its absolute best to protect you from the sun with a fancy little protein called melanin. It's in your skin and absorbs both UVB and UVA light. Having a lot of the protein makes you look darker. Your genetics define how much melanin is standard in your body, and or you can make it. When UVB light hits your skin, it only makes it through the upper layer, but it still causes direct DNA damage. So your body tries to protect itself by producing more melanin, though it can take a few days for the melanin to be produced and actually make you look tanner. UVA light is quite a bit different. It's higher energy, passes through the atmosphere, and penetrates your skin even deeper. Your skin releases stored melanin when UVA light hits your skin, so it protects itself pretty darn fast. But UVB is what causes long-lasting tans. UVA also doesn't cause direct DNA damage. Instead, it causes the formation of reactive oxygen, which in turn then causes DNA damage. Any DNA damage could lead to cancer, but your body has a lot of safeguards and repair mechanisms to hopefully fix any issues with your cells. You only get cancer when enough cancerous cells pass through all of these safeguards. So how do you protect yourself from the seemingly deadly cancer-causing sun? You can stay inside, wear more clothes, and sunscreen. Yeah, you knew it was coming. The SPF rating on the sunscreen will tell you how much it protects you. If you would normally burn after only 3 minutes in the sun, then an SPF 15 will allow you to be in the sun for 45 minutes without burning. SPF 50, 150 minutes. Even lower numbers protect you quite a bit. Most people don't need anything more than a 15 and maybe a 30. But also keep in mind that you're supposed to apply every 2 hours, and even more if sweaty or swimming. Sadly, the SPF rating only protects against UVB light, but some sunscreens will put additional chemicals that will help absorb the UVA light as well. Hopefully now you know a little bit more about the sun, cancers, and how to protect yourself just a little bit better.
And that brings us to the end of another episode of Masked Up, the internet's favorite community health live stream. And we want to thank the half of the internet that tunes in every week. We couldn't do it without y'all. I'm Andrew Defy. As always, shout out and big thanks to Netta, Allison, Atul, Esha, and the rest of the Protect Us crew. Sincerely, I'm just the face of this, but there's a team of dedicated medical students that put in a lot of work to educate me so I can help educate y'all every week. So until next time, like Mozzie said, health is wealth, and I need my bag. Remember, health doesn't come from a pharmacy, y'all.